So we're going to spend about 5 minutes and talk about SIMV mode of ventilation, or synchronized intermittent mandatory ventilation. So SIMV has fallen out of favor with quite a few physicians. However, there's still a lot of physicians that use it, so it's a mode that we need to be familiar with. In SIMV, you're going to set 5 things. You'll set your FiO2 and your PEEP, which we know control oxygenation. You're going to set a pressure support, which we know helps with spontaneous breaths. And you're going to set a rate and a tidal volume, which we know controls your minute ventilation, which will control how much carbon dioxide you remove from your patient. So now let's go to the vent and see what this looks like. So we've got our patient set in SIMV mode of ventilation. We're going to set a PEEP at 5. Again, this is what you're usually going to start at. We'll set our FiO2 at room air. You want to use the lowest possible FiO2 you need to oxygenate your patient. Quickly, we'll mention that as you go up on FiO2, you've got to go up on PEEP according to your PEEP table. Encourage you to review our oxygenation video. You'll set a pressure support. Here we're going to set a pressure support of 5. You'll set your respiratory rate. We're going to drop this down to 12. Typically, I start at 16 to 20, but 12 is going to make it a little easier for us to demonstrate. You'll set your tidal volume based on your tidal volume table, based on your patient's height. Again, we've measured Dr. Atherton. He is 70 inches tall. So when we put that into our table, that means his max tidal volume is 580 mLs per kg. That would be a tidal volume of 8 mLs per kg. Again, that's a hard cap. That's not our target. So we want to make sure we go below that. So we'll set our tidal volume to 500 to make sure we're below that max tidal volume. So you can see here, Dr. Atherton, I don't want you to initiate any breaths. SIMV, when our patient's not breathing, is going to guarantee you 12 breaths at this set tidal volume. You can see these are vent breaths because they're black on this waveform down here. So the question is, what happens when he breathes above 12 breaths per minute? So we saw in the assist control video, in assist control, every breath is the same type of breath at this set tidal volume. SIMV is different. While he's still going to get these vent breaths, Jeff wants you to go ahead and breathe a little bit faster for me. So he's getting these vent breaths. In between, he's getting some spontaneous breaths that are simply controlled by his pressure support. So what you do, Jeff, on your spontaneous breaths, take really short, guppy breaths. So we can see here, spontaneous breaths, they're much shorter than the vent breaths. It's still going to have 12 breaths of this guaranteed tidal volume, but in between, he'll have some spontaneous breaths that are assisted with the pressure support. And you can see here, he'll have different tidal volumes. This tidal volume was 233. This one was a vent breath and it was 657. This tidal volume was lower at 374. The tidal volumes will change based on what type of breath it is. So let's look at some vent settings and an ABG to test our understanding of this mode. Let's say I have the patient in SIMV mode with a rate set of 12, a tidal volume of 500, and a pressure support of 10, and this is what my patient's actually doing. They're actually breathing 20 times a minute. On those set breaths, they're getting that tidal volume of 500, but then on their spontaneous breaths, they're getting a tidal volume of 300. And I get this ABG. So this is a respiratory acidosis. I obviously want to get that CO2 down. To get CO2 down, I need to increase minute ventilation. Before we can increase it, let's look at what it is right now. So I know in SIMV mode, this set rate and the set tidal volume, they will get regardless of what they do. So I know that I'm getting 12 breaths at this tidal volume of 500. Those are contributing 6 liters towards my minute ventilation. In addition, I have some spontaneous breaths. So my total rate is 20 minus those 12 vent breaths. That leaves me with 8 spontaneous respirations per minute. And those spontaneous respirations are at that tidal volume of 300. So those are contributing 2.4 liters towards my minute ventilation. So currently, my minute ventilation is 8.4 liters. Now, what can I adjust to get this minute ventilation higher? Well, I could increase the pressure support to try to get my spontaneous tidal volumes equal to my mandatory tidal volumes and increase the total minute ventilation. If I do that and get those spontaneous tidal volumes to 500, then all the respirations will be at 500 and my minute ventilation goes up to 10 liters. Now, some physicians would argue if I'm going to do this, why not just change the patient to pressure support mode or a CPAP with pressure support and allow all the respirations to be spontaneous. Another thing I could do would be to increase their respiratory rate to 20 so that I'm assuring every respiration when they breathe 20 times a minute is at that set tidal volume of 500. If I did that, again, I would increase their minute ventilation to 10 liters. So some physicians would argue if you're going to increase the rate to match their total rate, why not just switch them to assist control and make the ventilator easier to manage? So let's review one more time. In SIMV mode of ventilation, you set a respiratory rate and a tidal volume. the patient will be guaranteed this many mandatory breaths per minute regardless of how they breathe. You also set a pressure support. The pressure support supports spontaneous respirations. Any respirations above that set respiratory rate will be spontaneous respirations utilizing this pressure support. This has been a review of SIMV mode of ventilation in about 5 minutes.